So this is James Esty with the GVU MSAT program. This is the video submission for the M13 individual assignment about the drug testing policy and dispensing and administrating drugs. So my Grinnell facility does follow like standard practice for drug testing. They don't have any like set drug testing periods, but they do have, like, if there is due suspicion, they will order a drug test for athlete or athletes. And then drug testing of the student body is the same way. If there's suspicion of not of the student body, of just athletics in general, if there is a suspicion of an illegal substance, then a drug test is ordered. If there's no suspicion, drug tests aren't ordered. The school does follow NCAA drug testing policy at national events. So if they get randomly selected at an NCAA event, there is no like pushback from that at all. As for like administration and dispensing, again, they follow pretty standard protocols. They don't really like have any policy set in place besides what they get from Dr. Albright. So they have some anti-congestants, they have Tylenol, ibuprofen, acetaminophen, your standard NSAIDs. They have some like hydrocortisone creams and like some general over-the-counter medications that we provide to athletes within reason. Dr. Albright has given us clearance to dispense those to athletes as needed. We only give over-the-counter doses. We don't give prescription strength doses. And if like there is warrant for like prescription strength doses, that has to go through Dr. Albright. He then prescribes the medication, and then we can then dispense that amount under his orders. How do I feel about dispensing over-the-counter medications? I feel good about it. Like, there's nothing weird about it to me. Just because I've been doing it with my preceptors, giving out 200 milligrams of ibuprofen for whatever reason, right? Not giving out prescription strength drugs for the most part, actually at all. And so that leans into the next question, like, how do I feel about administering prescription medications? Administering like albuterol, epinephrine, those kind of prescription medications I feel pretty comfortable with. Administrating like any kind of narcotic or prescription medication like that, I feel like I would be fine with it. But also I haven't done that yet either. Like an athlete, like we've had athletes get surgeries, but they just hold on to their prescription medications. So like they get it prescribed and then they're taking themselves. They're not giving it to us to then dispense to them or administer to them, for their prescriptions. That doesn't really happen. So like really the only things we do is albuterol inhalers and epinephrine. And then we do have access to like glucagon pills and like insulin for our diabetic patients, but that hasn't really come up. And again, I feel comfortable in the fact that like if I do it, I know I can and I'm not going to get in trouble for it if it's needed, because I have preceptor oversight and we are allowed to do that from our team doctor. But it's also like I have not administered like insulin before. So it'd be like, I've never done this before. So that's like, scary, but not in the fact that like, I don't know if I can do this or not. Minors, I feel like this about the same way. just because I'm not at a high school now, but I was at a high school last year for 2 rotations. The excuse me, the like the consent forms all had like your athlete is under care of the ATCs. Like, we have consent to care from patients and their families. If they have prescription drugs, we have consent to care to administer those. I really don't feel any conflict or like apprehension of administering or dispensing because we do have that consent pre like event. Like, we have that pre-administration, pre-dispensing event. If I was the only athletic trainer in a college setting, from what I talked about previously, I don't think anything would change about my ideas. And then same thing with a high school. Like, I would have those consent forms in place. I would be comfortable like dispensing and administrating because that consent is already in place. And then again, I would work under a physician who would tell me what over-the-counter medications I could dispense to athletes. So like, I'm already doing that with Dr. Albright at Grinnell, so I would feel comfortable setting that up with a physician if I was on my own in my career. And again, that goes for high school and college. High school, I would just have to worry more about consent from parents and guardians instead of the athletes themselves. But even in the college setting, we have to worry about that because some athletes are under 18 when they get here. Yep, there we go.